babies should lie with their back in a supine position. Now, I don't care whoever your grandma is or who told you that lying babies face side, tummy down will make babies to sleep well. Trust me, you are posing your baby at a higher risk of sudden infant death syndrome. Hey guys, so welcome back to my channel. It's your girl Nosmal, and on today's video we're going to be talking about SID, which is the sudden infant death syndrome. Now, SID is the sudden unexplained death of an infant within or less than 1 year of age. Now, I want you to also know that SID can also occur around 16 months of age, and also it's common, or its peak has been recorded, like most death has been recorded within the age of like 4 months to 2 months, or 2 months to 4 months rather. Now, I also want you to know that SID can also occur around the age of 2, 3, 4 years of age, but it's common around less than 16 months of age, and at its highest peak, or most death has been recorded around 2 to 4 months of age. Now, the cause of this sudden infant death syndrome is unknown, but actually there have been some risk factors that has been attributed to the cause of SID, which is the sudden infant death syndrome. Now, we're going to be looking at the first cause, which is maybe a damage to the brain, or will I say the part of the brain that is responsible for the sleep and wake syndrome. It could be damaged, and the part that is responsible for the sleep and wake in the brain is the brain stem, now, which is I think that's the hypothalamus or so. Yeah. Now, I want you to know that if the brain is having, or if the brain is damaged or has an issue, definitely SID is going to occur in these babies with those issues. And also, those who are also at higher risk are those that also have like respiratory issues, and babies who are like, will I say, has a low birth weight or has an ABGA score maybe around 4 or 5. Now, these babies tend to like also experience tend to suffer from SID, which is the sudden infant death. Now, remember I said that SID is not like an illness, is not like a disease, it's a death of a newborn or death of baby less than 1 year of age, whereby you see the death, it is totally, in fact, an unexplained death. But there have been risk factors, like I earlier mentioned, like I did not, or if, for example, that they are not up to date in their immunization schedules, or if mom herself does not, maybe is not will I say frequent with her prenatal vitamins while she was pregnant, can also pose baby for risks for also the sudden infant death syndrome. Then, if there is a trait in the family, or for example in the past there have been cases of recorded sudden unexplained death of an infant, so one should know that definitely it's kind of like is in the family. So as such, baby also born in that family are also at risk of the sudden infant death syndrome. Now, I want you to know that babies born with this sudden infant death syndrome are not like they are born with it. Actually, that babies that suffer from this sudden infant death syndrome is not like is an illness, or will I say is like a disease. This is where babies just go to, a mom can breastfeed her baby the same way, or feed her baby routinely, which is like every 2 hours for the newborn, or 3 hours, and the baby can just go to bed normal, same like every other day. And you see when the mom will be like, oh, my baby is sleeping so long, I think I should wake him or her up, and the mom just finds out that, oh, my baby is not waking up, and before you rush to the emergency, you discover that baby was brought in dead, baby is already dead. Now, that is an example or a typical case of a sudden infant death syndrome, whereby there is an unexplained cause or unexplained reason to why this baby died. Now, this baby just went to sleep like every other baby, and the baby just couldn't wake up. Like I said, can be as a result of issues with the part of the brain, which is the hypothalamus, that is responsible for the sleep and the wake syndrome. Now, we're also going to be looking at some of the ways, or will I say factors, in which sudden infant death syndrome can be avoided. Since we already know that unexplained death of an infant. And I also mentioned some of the risks that can make a baby prone to this sudden infant death syndrome. Now, why not tell you some of the factors or some of the major ways in which you as an individual can take to prevent this sudden infant death syndrome. Yes. Now, the number one on our list is babies should lie with their back in a supine position. Now, I don't care whoever your grandma is or who told you that lying babies face side, tummy down will make babies to sleep well. Trust me, you are posing your baby at a higher risk of sudden infant death syndrome. Please get that baby up. Let the baby, be him or she, I don't know, should lie on their back. That way it is safer, and baby should not even lie with their face sideways and tummy face down or lie side. Baby should always lie at their backs. That is the number one way to prevent sudden infant death syndrome. Remember, baby should lie at their back or in a supine position. Now, second on our list is that babies should lie alone. Now, this simple trick I want us to use now is using like the A, B, and C method. Yeah, our A will be baby should lie alone. I'm sorry for my faint marker, I couldn't get any. Then, which is the B, baby should lie on their back. I hope you are seeing this. Then for the C, baby should lie on in their crib. Yes. Now, in this side where I come from in Africa, parents are fond of sleeping with their babies, especially newborns, on the same bed. Please, parents, I hope you are seeing this video. Let your baby sleep separately on their crib or in their bed. I guess you are not informed, and now you are informed. Please take every measures to ensure that you are preventing sudden infant death syndrome, and as such, let your baby lie alone in their crib. And I want you to also know that you should make sure that there is no loose clothing at all. There is no stuffed toys around the baby's bed. I don't care if the baby can't sleep without that toy. Take off that toy from that baby's crib. Make sure that there's no loose clothing. There is no blanket. Just make sure that you swaddle baby very well. Or you can put baby, the normal way of maybe finish dressing your baby. Make sure that the bed sheets or wherever the clothing around that area, there's no loose clothing. Every clothing is properly kept tight, and lie baby on the bed to sleep alone. Now, I know you will be wondering, why did I say why should baby sleep alone? Would they get scared or anything? No, babies will get scared. And one of the reasons why we encourage that baby should sleep alone in their crib is to avoid suffocation. Yes, as an adult, you can mistakenly or unknowingly suffocate your baby, or babies can, maybe you know how babies can be torn and maybe use pillow to suffocate themselves unknowingly, and you wake up and you find out that the baby you slept with or your baby that was sleeping soundly close to you was not able to wake up. Now, that is a pure case of a sudden infant death syndrome. Now, to avoid that, let babies sleep alone on their crib. Now, if another way is also to prevent this sudden infant death syndrome is to make sure that if your baby's caregiver or you as a parent is a smoker, please do not do that where your baby is. For the sake of your baby, avoid smoking around your child. As such, you are preventing sudden infant death syndrome, and you are preserving your baby's life. Because as I earlier mentioned, that one of the reasons or the factors that poses babies to sudden infant death syndrome are those with respiratory issues. Imagine if a baby has respiratory issues and you as a mom or as a caregiver is smoking around the child. I don't know what you are trying to make of it, or what do you think is going to happen? Now, we talk about baby should sleep alone, baby should lie on their back, baby should sleep in the crib, and there is no no loose clothing among babies. Now, another way again to prevent this sudden infant death syndrome is to make sure that normal that your baby's immunization schedules are up to date. Yes, that none of your baby's immunization schedules are skipped, that your baby is being exclusively also breastfed. As that way you are preventing sudden infant death syndrome in your baby. Because remember I said it's highest, it's in peak of this death of these babies has been recorded around 2 to 4 months of age, but it can occur within less than 1 year of age or around 16 months. Doesn't mean it can occur at 2 years of age, 3 years of age, or 4 years of age. That is seed. I know that you should be familiar with maybe 1 or 2 cases whereby probably your neighbor or distant relative can just tell you that, oh, I went to bed with my baby and my baby died in the sleep. Oh, it's a spiritual attack. I'm not trying to tell you that there is no spiritual attack, but I also want you to know that that could be a pure possible case of sudden infant death syndrome. Now, to prevent you and I for crying against or losing our loved baby, we should try and avoid sudden infant death syndrome by allowing your babies to lie on their back. That is the major important one. Please do not lie baby face side, tummy down, or at the side. Make sure that your babies are lying at their back, they are lying on the crib, they sleep alone. You as a smoker should not be around these babies, and you should know, make sure that the immunization schedules also are also up to date. That way you are preventing this death of a newborn. So I don't think there's any other thing I haven't mentioned in this sudden infant death syndrome. I've talked about the possible causes, those that are rigged. Okay, then something I'm forgetting. If, for example, that in your family there, I think I mentioned that earlier, that if there is an history of previously recorded case of sudden infant death syndrome, you should know that you should be extremely careful, and also make sure that your babies, like, they beg after feeding them before going to bed. That way you are preventing sudden infant death syndrome in these babies. Now I think that this video is quickly like a short video but an interesting one. So if you have any question or anything you want me to add to this video, please let me know in the comment section. Let's discuss, and I'll see you in my next video. Bye bye.